Thanks, folks. As I said, my name is Chris D'Onofrio. I am guest facilitating for Terry Bryant, who is away today. Welcome. Thanks for joining. This is the Whatcom County Coalition to End Homelessness. This is a group that meets monthly, and we always have a good time. So let's start with a land acknowledgement, which I will read. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We are gathered here today on the unceded ancestral lands of the Lummi, Nooksack, Samish, and Semiahmoo people. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. Again, thank you for being here. For folks who are new or joining again, please go ahead and introduce yourself in the chat. If you wouldn't mind stating your name, gender preference, gender pronoun preferences, organization that you may or may not be representing, and perhaps the reason you're here today. That would be helpful. If you are not on the mailing list but have been informed through other ways of these meetings, go ahead and include your email if you'd like to be added to that email list as well. Okay, moving into the agenda here, item 3, reminders and announcements. First off, Housing Week is coming up soon. I should click the link and be sure. It's not next week, but it's the week after. This is an annual event hosted by Sustainable Connections, particularly their Whatcom Housing Alliance department team. There's a lot of great events there. It's a lot about affordable housing, zoning. They touch on homelessness, which we know is connected to those things. But some good opportunities to do some networking, meet some folks that you might be able to work with, some folks that are like-minded, and potentially partners in that work. So I'd recommend you check that out. There is a link in the agenda for more information. They do ask that most people register for events ahead of time, but they make it easy for you. The next item is a reminder to vote, and that goes for everyone. People experiencing homelessness are able to vote. They have a right to vote. There's a link there in the agenda about how you might assist people experiencing homelessness with getting registered to vote and completing their ballots. So we hope that you will take the time, if you work with people of that population, if you yourself are experiencing homelessness, know that your vote is just as important as anybody else's. So there's opportunities to learn more about that process and get involved in the election. Another great announcement is that the Recovery Cafe program is starting to work. I've got a little pamphlet here on my desk about it. This is a new program. Learn more clicking on that link. They've got information there. It's a great, healthy way for people to connect with others who are on their recovery journey or have gone through it, to support each other and build those connections there as well. And I think that takes us to the overview of the Whatcom Resource Information Collaborative. Drew has agreed to give us some of his time today to help folks understand a little bit better about what that is, what it can do for you. He might want or need some screen sharing capability here, which I don't know that I have the ability to grant. Drew, are you ready to go?
I tested it just briefly a second ago. I should be able to screen share as I need to.
Excellent. Well, thank you. And I think the camera and mic are yours. So let us know what it's all about.
Awesome. Well, hey there, y'all. Probably some of y'all have gotten this spiel before. I've been making the rounds on doing spiels. But I'm Drew. I'm the lead resource data specialist here at OPCO. And my kind of bailiwick here is the whatcomresources.org/Whatcom Resource Information Collaborative Project. Just provide a smidgen of background. So the WRIC, Whatcom Resource Information Collaborative, alphabet soup. The WRIC kind of developed out of resource roundtables from the community pre-pandemic that identified a need for a one-stop shop for social services, for human and social services in the community. It was kind of expressed to us from the public, from our community members, that Washington 2-in-1 wasn't cutting it, and we didn't really have a good way. And people were, picking up the phone and calling for help someplace, and then getting redirected to another place, and then another place. And we're trying to, there was a need for that. So in response to that need, we've been working over the last 3 or 4 years to build WhatcomResources.org, and we now have a fully functional directory that compiles and presents information for Whatcom County residents, and also for health and community service workers like you guys, to help out the people you're working with. So the way I always kind of say it is the WRIC, the Information Collaborative, is kind of the governing body over the directory, over the website. And being an information collaborative, that means we want you. So if you're interested in contributing and participating in helping guide WRIC, I will talk a little bit more at the end about getting involved. But it is a collaborative, it's open to everybody. So that's kind of critical. But let me share my screen now. Alrighty. So I have the little About Us page open, but the meat of the presentation I want to talk about is WhatcomResources.org, and this is the homepage of the directory site. So this is a directory. It's for people to search and find stuff in, and we maintain a database that I'll also talk about that feeds all the information to this directory. But this is the site. You get there from Whatcom Resources with an S.org. We also actually are pretty good on the Google rankings. We're getting a lot of SEO hits. So if you search for various social services, we usually pop up pretty high in the Google rankings. You can Google it. We also are linked in on the Whatcom County Library System website, which is having some issues at the moment. So we're kind of all around. But the easiest way to get to us is WhatcomResources.org. And then you're presented with this homepage, and you can type in here to search for stuff. So you can search for anything. I'm going to actually close this tab because I want to search for it, because this was just brought up. So if we search for the Recovery Cafe, and you can see we've got the Recovery Cafe in here. Provide safe, inclusive, community-oriented space where peers can support peers in a unique recovery journey. We try to include as much information. We try to keep it brief, because the idea is to let the organizations and services speak for themselves. So we kind of want to give people a taste and then get them moved over to your site or to the resources site. So you can see we've got the address here. We've got their Facebook page. The Recovery Cafe's Facebook page is the best website version we have for them at the moment. And so all that kind of goes right to there. We also have a call button here. We don't have a number affiliated with Recovery Cafe at this moment, but you can also call directly. And especially the call button, is really nice because this is all mobile and desktop. So when you click that call button on your phone, if you're searching on Safari on your phone, then you click that call button, it will initiate the call for you. So it all kind of flows together. So that's kind of the very basic, search for stuff. You can type stuff in here. You also see stuff pops up down here, and these kind of give you additional categories to search on. So because I typed in Recovery Cafe, it's like, were you searching for addiction and recovery resources? And if I say yes and hit search, it shows all of the ones we have tagged with that tag in our backend, essentially. And you can see there's a whole lot of them here. Which gives me a nice little chance to say that you can also search and filter by location. So say we want to use my location, and it picks me up as at F Street. I'm over on Cornwall, but close enough. And let's say 2 miles, and we hit search. And now we go from that 100-odd number of resources down to 62, and it's going to show me what it reads as closest to me first. So the very first one it reads to me is the Sean Humphrey House. Um, so overall, we have, I want to say, well, let me look real quick. We currently have 846 services in our database, spread across 251 organizations, for a grand total of something like 970 hits, something like that. Um, and that's the amount of information we have in here. Another thing that we try to do with WRIC and with WhatcomResources.org is to continually update and verify information, because that was another pain point that was expressed to us years ago, was that the information on 211 was outdated. So we maintain a commitment to re-verify all of our resources every 6 months. So we kind of have it broken down into like re-verifying each organization. We have it like bunches rolling for each month. So we re-verify on a 6-month rolling basis to try to get new phone numbers, make sure websites aren't down, add new services, remove old services, that kind of stuff. Um, so that's the basis. That's the basics of searching and using the site. You can also, aside from typing in stuff here, you can see we've got categories down here. I want to get rid of this real fast. Um, And so for like, ending homelessness here, if we click the emergency shelter one, it shows the emergency shelter resources we have in the database. The Husley, the Pad, Base Camp, a couple others. So, and again, we're always looking to add new stuff. Um, the other little, the other side things I like to point out on this site is we do have the entire database directory translated into Spanish as well as English. So if you go up to here and just flip this over to Spanish, everything is now in Spanish and it's full text searchable in Spanish. So you can type in Spanish in here and it will search just like it does with the English one. Right now, that's the only full text searchable language we have. And we're looking at adding more in the future, but our web developer, it takes a bit of time. You can always, as everywhere, do a right click and translate with Google Translate as well. I always like to include that just in case you weren't aware that you can translate stuff into like a bazillion different languages. Uh, yeah. Uh, go back to English though. The last thing I really like to point out, especially for folks like us, community health providers, people who work with the public case managers, is the favorites that you can create, because you can create lists that really are super duper helpful. So if you look up here, we've got this little favorites tab. If you click on that, you have to make a little login. I'm already logged in, but you have to make a little login. Once you do, you can create lists of resources that you can share with the public, or you can embed as links to things. So for instance, I have this list of clean and sober housing. When I view the list, it shows me all of the clean and sober housing resources that I've put together. And that way you don't have to rely only on our search categories. You can create your own unique list of resources. So that can be helpful if you're working with somebody and you're like, hey, you need access to the Basics for Babies program. You need the Ferndale Community Services. You need, you can put together 4 or 5 services that don't necessarily match, but that are useful for an individual person, and send them that link. And that just gives them all the resources all together. And the way you would do that is you come in here, you create a new list, and then you would want to make sure to make it public, and that lets you share it. And then once you can see like my clean and sober housing list is public, when I view the list, I can click the share button, and then I can share to various services, or I can literally just copy and paste the URL link. So. The other thing I like to pitch this for is to replace lists that you create that aren't updated, that are like discrete and get outdated. So working here at OpCo, I am well aware that we put together so many doggone like printed lists and lists of various services that get stuck on a link somewhere, and then a year later, it's like, whose job is it to update that? Wait, does anybody remember if this place is closed or not? Um, and so what you can do is you can use WRIC instead, and we'll update and remove closed services, change phone numbers automatically. When we do updates, it changes on the list here. So the example that I can show you here is already on the WDC site. Perfect. On the Whatcom Asset Building Coalition site, we've got a whole housing hub with a bunch of different links in it. If you click this housing search on clean and sober housing, we used to have just a PDF that somebody made that was linked here. But then it was whose job was it to update that PDF? Where was the original? And it became out of date. So what we did instead of just making a new PDF and trying to, remember to go update that PDF, and log into WordPress and all that kind of jazz. Now this is just a link to whatcomresources.org. And it takes you to the sober living category. And so now when we add a new sober living resource, it'll pop up here. If you know if Oxford House has a phone number change, that phone number will change. We don't need to worry about re-editing a new document. So I really do like this utility. The one other thing I always like to point out with favorites lists is that because we list publicly accessible information, the phone number of social services, the websites, stuff like that, our lists are not HIPAA compliant. So that's one thing is when you're making a list, if you're using it for like casework, you don't want to include any personal health or personal identifying information in the list. You just want to have a list of resources. So if you look on my little thing here, I have something like this one, just like random numbers and letters, and you might find these useful. That wouldn't violate HIPAA PHI to share that publicly. So I just like to point that out because again, we're a publicly accessible website, so we don't need to comply with HIPAA, but in your own jobs, we all need to comply with HIPAA. So I like to make that clear. That's kind of the basics of searching and using the site. Again, it's desktop and mobile friendly. I've actually seen a lot more mobile traffic over the last 2 or 3 months, which we usually attribute to public users rather than like community health workers. We're mostly on desktops and laptops. So it is friendly for mobile. If you see a resource that isn't on here that you think should be added, or you guys are doing something and you're like, it would be great to have it on here. We have this button here that submit feedback that takes you to a little web page. It gives you a second to load. Pops in with this form, and you can type in a new service or recommend an update because updates don't happen every 6 months. Updates happen whenever. So if something has closed and you see it's open on there, you can hit update and let us know. Or you can just put a comment about, Drew needs to get jazzier with his presentations. So you can kind of add any of that, and it goes right to us, and we jump on those suggestion boxes pretty doggone quick. WRIC itself does work to add more resources. We will identify weak points in our data. We'll identify like inclusion groups or inclusion types of services, and then we'll focus on those. But outside of those foci, if you guys recommend something, I hop on that and try to get it included or get back to you and be like, well, we didn't decide to include that because of X reason. So I try to get on that form really quickly. There's also more information about WRIC on this page and on the About Us page. You can see we have an inclusion criteria. We have our charter, and then we have stuff about how to contact us and to join WRIC if you'd like to join WRIC. And again, collaborative. We want people to get involved. I'm always looking for more feedback. So yeah, the last thing I'll mention, is a little sneak preview for the future, is we've been working with the county on focusing on behavioral health and substance use disorder resources. So we're adding those. That's kind of our focus point for the next few months. But we're also working on a trainings and events calendar for health and for community and health resources. Um, so we're hoping to launch that in November. And that's the idea behind that is going to be it's community populated and WRIC curated. So we've got a whole setup where like this is embedded in a web page and you can submit things and then we say, yes, it belongs on here. No, it doesn't. We have an inclusion guideline that we'll have published alongside it in order to try to create a calendar for people looking for community health related things, both for the public and then also for community health workers. So you can see I've been working with Whatcom County Library to have some test ones on here. And so there's some of the public ones they were doing, and then some of them are a little bit more focused on like the community uh, county health and community services like trainings and stuff. So, but that's a little teaser that's not yet launched, but keep an eye out for that moving forward. That is my quick version here. I'm gonna look at the chat. And also if you throw some hands up, I'm happy to answer questions. Let's see, going through the chat, asking about printing. Yes, we can print. It's not quite as pretty as the Wacom ABC print, because those are handmade on Canva. So if you go to the favorites list, and we'll just do this clean sober housing one, when you click share, you can click print and give it a second. Our printers are slow here at 1111. Takes a minute. So you can see this is the formatting that it prints with. It's not quite, again, it's not all bespoke and pretty like the WABC ones, but it does exist. Okay, I'll get to the other chat questions in a second, but Jim has his hand up. Yeah.
Yeah, hey, great presentation. A couple questions. So, who built this thing and who paid for it?
Okay. The WRIC itself, Wacom Resource Information Collaborative, is a grant seeking organization essentially. And so WRIC has gone out to get grants. And so we have a grant through Whatcom County, we have a grant through the Mount Baker Foundation, and one or two others that help support this project. When it comes to building it, WRIC members, specifically Opportunity Council as the data steward, we kind of hold the data just so that it's in one place, went through and compiled the database. So this is the big database, big spreadsheets of everything. So we compiled this database, and then we contracted and worked with a company called Connect 2 and 1 to create the front-facing interface. So if you're really astute and you look, you can see the similarities between Wacom Resource Directory and Washington 211, and that's because we use the same web developer behind the two systems. So does that mostly answer the questions you were trying to get at?
Yeah. One more. So, to operate this thing now and in the future, who's paying for it?
So we're still actively fundraising to ensure sustainability. One of the reasons why Opportunity Council acts as the data steward is we can kind of be a backstop where if it's necessary, we can at least maintain the database should grants run out and funding run out for the front-facing directory side. The database is really low cost to maintain. So at minimum, we can maintain that database. But again, the RIC is currently actively seeking, like always trying to get more grants in order to ensure long-term funding and stability.
Yeah, everybody's looking
Everybody
for
is,
funding.
yeah.
But great job by the Opportunity Council to continue this, as well as the collaboration by many groups and organizations. What a resource. Great job.
Yeah, because I do want to say, like, well, I've brought up OPCO a couple times. This is our big like brick table here. There are a ton of organizations that are also involved, not just OPCO. OPCO just acts as the data steward. So, our secretariat, it kind of who helps lead WRIC is Christy from Whatcom Family and Community Network. And so we have a whole bunch of organizations involved.
Yeah, great job. That's all I have.
Okay, so we had printing. Vaughn brought up something from a previous presentation I said where I do actually track what searches we get where there are no hits. And so I do keep a running tally of like what the community is looking for. And one of those that we've gotten a number of hits is like automotive repair. And no, Vaughn, I have not yet found automotive like discount automotive resources to qualify. So if anybody knows, I would love that. And then Katie asked, is there still a vision for WRIC to be able to interface with medical records at health systems? Yes. So the fancy alphabet soup terminology of that is CIE, a communication information exchange that can do referrals, like warm referrals between sites. That is still hoped for, but I've got to say that is like just understanding the technical hurdles behind interfacing between the different systems. That's a long-term goal. That's not going to happen next year. But in an ideal world with full grant funding and where we have some real time to get momentum and build all these systems up, we would love for that to happen. And that is the long, big objective. Those are the questions in the chat. Anybody else have questions? You can put it in the chat if you don't want to hop on up and chitter chatter.
Well, that's a really impressive resource. Thanks so much for sharing that. Thanks for all your work on that. Questions may come in the middle of the night. Probably not the best time to voice them, but for folks that have ideas or suggestions, I'm sure Drew would be happy to hear those. And Drew, did you get your email address up in the intro?
I will drop that in the chat here in just a second. Mine and then the generalized WRIC one. And then again, you can always submit feedback if you lose those emails. That submit feedback form comes straight to me. So if you do, you're like, who was that guy? Who was yammering at me? Then you can do the submit feedback as well. So.
Okay, this might be one of those tabs I have open on my browser for the next 6 or 8 months until I accidentally close it. So
bookmark it.
Really cool.
Bookmarks. They're the bomb.
There you go. There you go. That's smarter. I'm the guy that showed up with the crumpled up pamphlet and then you pulled up the recovery cafe thing right away. So there's a subtle difference there. But yeah, thanks again, Drew. Thanks for coming in and sharing your time to present that with us too.
Certainly. And I'll hang out. And if there are more questions or anything like that, just drop them in the chat. Something.
Cool. All right. Well, as we're talking about resources, the next part of our conversation today is going to shift slightly over to emergency shelters. Obviously, a very critical resource for people with immediate need for a safe place, one place to be. I have asked a few folks to join us and give a little overview of what their plans are for this coming winter. They're listed there on the agenda. If you don't have it in front of you, we're going to hear from YWCA, Lighthouse Mission, Ferndale Community Services, the Waystation project, as well as the OC Opportunity Council Motel efforts. And then I'll share a little bit about the county severe weather shelter planning. There's a little bit of anticipation that there's some Q&A there. I wasn't sure if we would do that with each provider when they give their piece or if we wait till the end. Kind of feel like just doing it as they come makes the most sense, but just throw out your questions when you want. And then maybe we'll get to those at the end of each presentation. We have about 60 minutes left on the meeting, so I'm going to ask folks to be relatively concise, and then give your information or whatever it is to allow people to have follow-up questions if they can. We are hoping that we can put together a resource. Maybe this will go up on the RIC. I think now that I know more about it, that makes the most sense. But perhaps send things out in some kind of package for attendees so that they can review the information that they get today. And we'll ask that I get up there on that RIC too, because I think that makes a lot more sense. Without further ado, let's kick it over to Allie, who is here to talk a little bit about what's going on at the YWCA these days.
Thank you. I'm gonna apologize. I have a cold and my voice is kind of hoarse, so bear with me. We have two shelter opportunities coming up with our winter shelter and our new building. I'm kind of hoping, and I also kind of want to lead with a caveat that all of these things are still contracts are being built. So I'm expressing my hopes and wishes for the programs, with details kind of to be formalized in the coming months. We are hoping of starting our winter shelter program, which is going to be a hotel model again this year, for 20 rooms that will have designated for women and children that are ages 0 to 5. We had a split population for our hotel model last year, but because we have the opportunity of opening up our new building at the same time, we're hoping to use it as a stepping stone. So we're sticking to the single population that is then going to be transferred over to the new building. For winter shelter purposes, we're hoping that the shelter will be operational. I'm hoping late November, early December, and I'm going to say ish in there. And then our new building is supposed to be operational by March 1st. Again, I think that sometimes with construction projects, I can be a little bit naive. So I'm hoping that that's our goal date. And then we'll have kind of a staggered start from the end of the winter shelter to having people enter the new shelter building, hoping to have an easy transition. We're having a similar model in each program so that the hope is that we don't have to exit anyone at the end of the winter shelter so that we'll be able to have that easy transition. Like I said, there's going to be 20 units, and the new building has 15 or 16 units that are built for a single mom with one child. And then there's a handful of units that can have a larger occupancy. So we're going to have it up to 2 children. Again, we want to keep it with the 0 to 5 age range. And trying to think of what other notes I wrote down to share with you. We will be using coordinated entry for almost all of the rooms, and 2 or 3 of the rooms are going to be designated for emergency services so that we can use it by a night basis. And the best form of communication is just going to be calling the Y to see if there's an open spot. Again, more details to come on that, but we really wanted to be able to utilize, because it's going to be operated with 24-hour staffing, we have the ability to bring someone in the middle of the night if they've been discharged for the hospital, or if there's some sort of dire situation, we wanted to have that ability to bring people outside of normal business hours. Again, for the winter shelter, we're hoping mid-March or kind of end of February end date with an ease into the new building. Trying to think of ways the community could help. I'm sorry, Chris, I'm going through your questions to hopefully ease everybody's questions. We're going to be putting together a fund drive, not necessarily for monetary funds, but for if anyone wants to donate to maybe sponsor a room or help furnish the building. We're working on putting together a list that will be active on our website so people can contribute in that way. Like I said, there's so many things that are like, oh yeah, this, oh yeah, that. And all of those oh yeahs are being consolidated into a list right now that we're hoping to put details to and consolidate information. I would be the best person to contact, and I put my name in the chat already with the introduction if you have any further questions. Sorry, did you say you want to do it each questions now?
Yeah,
Whatever.
I feel like if people have questions, now would be a good time. If they're kind of bigger questions for the end, or if they think about it later and you're still around, maybe they could ask then.
Okay, I just blew through that for the essence of time, so please let me know if there's any questions. Okay, I'm going to hand it over then.
All right. Well, thank you, Allie. Appreciate the work you're doing and sharing that information with us here today as well. For the next shelter on the list, LMM, Lighthouse Mission Ministries. I exchanged some emails with Brittany Hargrove. She wasn't able to make it today, but she did give me some information to share. I have her email address, which I just put in the chat for any follow-up questions. And we're talking about their kind of their winter activities as different. Most people probably know that they're opening a new shelter down on not F and Holly, F and Astor Street it is. So we're not talking about that here. That should be opening up in a week or two, and will have its own set of services. And there's opportunities to learn about that as well. I think they're going to have some building tours coming up. But the seasonal operations, specifically around winter severe weather, they are looking at having 20 beds for single adults and their well-behaved pets that will be ready to start operating on November 1st is their estimate. They're also going to have some crews going around handing out warming kits at the end of October. The winter shelter beds, the weather beds are going to be on the 3rd floor of their new building. So it's right there at the same location. It's going to be on a first come, first served basis. They're saying that folks can call ahead to see if there's a spot available, but they are not planning to reserve spots. They really want to make sure that they get used and aren't looking to hold spots for folks that may have other opportunities come up on the way or aren't there for some reason or another. They think this is going to go through the end of February. That's their plan at this point. And as far as community support, they are always looking for volunteers, and then they will accept things like coats, blankets, or other cold weather items that might make things a little bit more enjoyable there. So again, Brittany's email is there in the text. So go ahead and reach out if you have more questions, and we'll try to keep you updated if anything changes. We'll meet again in December with this group. So we'll let you know if there's updates to that. For folks on their phone who have a hard time seeing the chat, Allie was asked if there's a change in capacity at the YWCA, and her response is no, this is additional services on top of what's happening at the main YWCA building. All right, I will minimize that window and move over to Ferndale Community Services. I don't recognize any of these names with Ferndale Community Services. Is there anyone here from Ferndale to talk? Okay, I think that's a no. I'll give a quick spiel on that as well. So Ferndale Community Services, we're a contracting partner with them through the County Health Community Services. They have plans for a 15-bed shelter in Ferndale hosted at the United Church of Ferndale. This will be a severe weather shelter on a first come, first served basis that will open on those coldest nights of the year, which is plans to be when it's going to be at or below 32 degrees for 4 or more hours as the low, the overnight low. This is more or less the same as what they were doing last year. I don't think I have any additional information at the tip of my tongue here. So I think we'll leave it at that. 15 beds in Ferndale. You don't have to live in Ferndale to use them. They serve northwest Whatcom County, and they plan to be open roughly the same period of time as Lighthouse, opening sometime in November and being there until probably March 1st or mid-March, depending on the weather and things like that. I can do that. Donna, I will get you their information and put it in the chat here in just a moment. Okay, great. And that brings us to the Waystation, which is not an emergency shelter as these other ones are. Sometimes in housing services, we talk about like day shelters as shelters, but really this is a hygiene facility that's more focused on health and hygiene than it is on overnight accommodations or places to sleep. But I will let the folks who know more about that do the talking and do the explaining. So I invite whoever's prepared to speak to that project to go ahead and do so.
Awesome. Thank you so much, Chris, and thanks for clarifying. I'm Nicole Fields. I'm the Population Health Manager here from Unity Care, and I am presenting today with Don Cook, who is the birthday boy, also from Unity Care. So happy birthday, Don. We're excited that you're here with us. If you don't mind, I'm going to share just the quickest 4-slide PowerPoint because I think it's easier to have a visual aid with some of this. than it is to not have that. So let me just quickly share screens and I will tell you all about the Waystation. So the Waystation is going to be opening up very soon. We do not have a firm date, but we think it's going to be October 29th for our hygiene services. So as you can see, the Waystation is a safe and welcoming facility. So for folks who are experiencing homelessness to be able to access an array of services. We will have medical and behavioral health services there. So it's going to be walk-in medical care. So anyone can walk right in and get an appointment that same day if they're experiencing homelessness and need some light medical care. We are going to have SUD treatment, so substance use disorder treatment, and primary care behavioral health services there, so they can get some light touch behavioral health services and referrals to other partners, along with our hygiene services, which include restrooms, showers, and a laundry facility, so folks can do their laundry for free. We also have a hot box for folks whose belongings might have some body bug issues like bed bugs or lice, that we can heat up to a safe temperature to make sure that all of those bugs are killed on things that can't be washed, like larger backpacks, sleeping bags, all that kind of stuff. We will have case managers there to help folks get set up with community resources, connect into primary care, and navigate their care plan. And then insurance enrollment services and hopefully some housing navigation provided by Opportunity Council. And then the other side of Waystation is going to be that recuperative respite care provided by the Opportunity Council, which I think Marisa is going to talk to you about next. So I mentioned some medical services. I'm not going to read this slide to you, but I think it's important to put up just so you can kind of get the feel for the type of medical services that we're going to be offering there. It is really around that walk-in primary care for acute symptoms. We're not trying to be anyone's primary care provider at the Waystation, but we realize that folks that are experiencing homelessness might not have a primary care provider that they're able to connect with regularly. And so we can be that kind of bridge into the primary care system. What that might look like is some on-site treatment for some of the conditions that you see listed here. And then they'll also probably be getting a referral into their primary care provider to like check back with them in a few weeks, or let's get you established so that we can make sure that we're like managing your chronic diseases as well. So other services provided, I mentioned most of these very quickly, but this is just a little bit more detail on what this will look like. For the hygiene services, we will have 4 restrooms, 4 walk-in showers, and then 4 washers, 6 dryers. And then I also just want to point out, I'm going to show you our floor plan, that we are a pretty small facility. Our capacity for like people in this side of the building is only 26 people. And we have, 10 staff. So we're looking at being able to get, 15, 16 people in at a time. It's not huge, but it's some really great services for folks who might not be able to get them elsewhere, and for folks who need a place to take a hot shower, use the restroom, or wash their clothes in a really safe and welcoming environment. So I'm going to take this down. Yes, I would be more than happy to send you this. It's a very quick presentation. Chris, I can send it to you and then you're welcome to send it out. Yeah. Okay, great. Any questions for Don or I? I know we went pretty fast.
Yeah, I'll throw one out there, and sorry if I missed this. I was trying to multitask a little, but is there an anticipated day when these services will become available?
That's a bad question, Chris. Very bad question.
Sorry, I shouldn't have led with that one.
There have been so many dates, and they've all gotten pushed back. But you know how construction goes. So we're thinking hopefully the 29th of October, and then rolling out medical a couple weeks after in mid-November. But it's changed so many times as we try and get this construction finished over the building. So yeah, Don, I hope we didn't trigger you too much with that question.
On his birthday too,
I
nonetheless.
know,
I
I know.
know. You imagine.
Katrina has a question in the chat here. She's asking about which barrier level will there be?
So are you talking, Katrina, about like the HUD definitions of being oh, will folks be trespassed for bad behavior? So I think it depends on what we're looking at for bad behavior. You know, like I feel like we have a pretty high threshold at Unity Care because we serve a lot of folks who are unhoused and a lot of folks who like this is their last chance for medical care in our community. And so we have a really robust policy and our staff are trained and expect to work with folks who are having disruptive behaviors at any given time. And I think the threshold where we start to look at banning folks would be when the behavior gets dangerous. So if staff are in danger, we want them to be empowered to tell folks, you know, maybe today is not going to be a good day for these services, and ask them to leave. We tend to go with a ban before we go with a trespass. So a ban could be 7 days or 30 days and gives folks a chance to like kind of understand perhaps consequences of the behaviors or work with their case managers to access our services a little bit more successfully. And then in some cases, like we've had folks brandish a weapon at staff or physically assault staff, and that's going to be a trespass. So we have some boundaries around that, but we try to be pretty low barrier.
And then is this going to be sort of like just anyone walk in at any time? Are there processes for longer stays that need to be followed? How do folks make use of these services?
Yeah, Don, jump in anytime if you want, but it's going to be all walk-in. And Don, do you want to talk a little bit about like the signing up for appointments and stuff, or signing up for slots for the?
Yeah, so yeah, it's gonna be walk-in basis, and we'll have, well, like for the showers, they'll have 15 minutes to take showers. Give or take. I mean, we'll of course flexible depending on the uses and how many people are waiting, but 15 minutes to take showers. Um, and we're going to treat it like, I don't know if you guys know about the shot team. So they're like, they come in, they sign in, the next person in. The only difference is that because of the capacity of the facility, that once we're at capacity, we will have to lock the doors and have folks come back later at a later time, or kind of give them like a time to come back. Yeah, so for the showers, 15 minutes to take showers. We'll have hygiene products for them to use. For laundry, they'll probably have like a total of an hour, like washing and drying. So they'll be able to just hang out, hopefully talk to community health workers to see what type of resources they could get going, things like that. And then with the restrooms, it's open. I mean, just if you need to use the restroom and there's a restroom open, come on in. We'll get you in there. So it's pretty.
And Don, it's a load of laundry every other day. Yeah.
Yeah, I'm sorry. Yeah, load laundry, one load every 3 days.
Every 3 days.
Yeah, so we have to be particular with that. Again, depends how busy we are. Well, we can be nice. But again, one load every 3 days for laundry. Did that answer your question, Chris?
Yeah, yes,
Okay.
thank you.
Okay.
There are 49 folks in the chat. Are there any others with questions?
Oh, and of course, like for medical, we'll sign for medical and behavioral health as well. So again, we'll have 12 spots for medical for folks to come in from 8 to 12. We're starting out 8 to 12. And then the more the need, the more we extend those hours. So 8 to 12 for medical, and for behavioral health is actually going to be from 7 to 3 that we'll be able to see folks for behavioral health or SUD as well. So we'll have both those process there.
Great. And I have another question. Will guests or clients or folks using these services, will they need any like identification? Are they supposed to be based in Whatcom County? Are there any requirements on who can get served, income eligibility, stuff like that?
So if they're unhoused, we'll serve them. We're not going to be like, what county are you at, or where are you coming from? So we're not going to be like that. Again, if they don't have any ID or anything like that, that's fine. We'll get them in. And again, we'll have the community health workers there to help them if they want to try to get ID, to talk to the community health workers to work on that as well too. So try to be like a one-stop shop. So unfortunately, we're limited in space. I'll read the question. Is there what was the question there? Is there a specific secure area to place belongings while waiting for showers or laundry? So that we went around and around with that one. And unfortunately, there is not a place for folks to secure their belongings. And again, we're limited. So we'll maybe say like 2 bags you bring in, but if you have any other thing, unfortunately, we'll have to see if you could have someone else watch it, or there's a space in the back that you could put it. But yeah.
I
It's
will
tough.
say too, the way that the showers are designed, it's like you go into a room basically, and there's like a bench, and then there's a shower stall that's within the room. So there's room for you to bring like your backpack or your load of
Yeah.
laundry or whatever into the shower with you, and you don't have to be separated from it.
Yeah. But anything bigger than that, yeah, we can't. What was the next question? So the cool thing with the laundry is the detergent it actually is automatically automatically into the washer, so we don't have to give anything out. They just push a button and do the laundry, making it really easy for them. And it's always hot water. Can't do anything in cold water, just hot.
And yeah, they do it themselves.
They do it
We
themselves.
won't be handling the laundry. And then we have a good amount of hygiene supplies right now too. So we have like, we'll be providing shampoo, conditioner, body wash, that kind of stuff. But then we also have things for hygiene kits like toothpaste, razors, shaving cream, chapstick, sunscreen, all that kind of stuff. Ooh, and one of our Unity staff so nicely direct messaged me this, but I'm gonna put myself on blast and put it in the real group because I think people will want to know. And they asked if there's a plan for bringing pets. And gosh, we went around and around on this a bunch of times, and it's just with our insurance carriers, we could not get around like letting people bring pets into the building. And so unfortunately, we will not be able to allow pets. We've had some talk for in the future of putting like maybe some kennels outside the Waystation that folks could use while they were inside. But I think that's like a down the road thing, and we're just not quite there yet.
Well, thank you both so much for presenting today. Thanks, Don. Thanks, Nicole. I appreciate your time here, and obviously all the incredible work that's gone into this project. I know people have been talking about this for years, and I would imagine while other people are talking about it, you're doing the work to actually make it come about. So that's huge, and it's greatly appreciated. The PowerPoint is coming into the chat, so folks should be able to download that here. Drew looks excited. I'm excited too. There's a lot of good information in there, and we can send that out to the list for folks that weren't able to attend today, so they'll at least get that information more or less from the source. If there are no further questions, I think we should move on to Opportunity Council. I don't know if there's any specific staff who was planning to speak about the motel program here. I see a hand waving, so I will click mute and let that transition.
So I think Diane is actually online to be able to speak about the motel piece, but I just wanted to give a couple quick updates. So our SHOT trailer, shower hygiene outreach team, that trailer, the last day of business for clients is October 27th, and the shower trailer will be decommissioned on the 31st of October. The plan for that is for it to be moved to the new set of tiny homes for Homes Now on Northwest. So it's going to go to good use, and then we're just going to advertise all of our current shower clients to come and see Dawn and everybody on the hygiene side of Waystation. And then I just wanted to throw out that Waystation Medical Respite is still going for planning. We're getting really close to completing construction. And just to give everybody an idea, it is a program that is in partnership with Peace Health. We'll be accepting our referrals directly from Peace Health, and clients will be able to come and stay with us. You know, we might be looking at an average stay of quite possibly up to 3 weeks, but it's going to be very dependent on each client's situation and their needs and how well they're healing. We will be taking these referrals for people that are literally homeless, that are not bad enough to stay in the hospital, but not great enough to be able to be discharged back into the community or whatever program they're a part of. We do have a lot of plans still in the works, so I don't have a ton of details to give at this time, but we are really close to getting a lot of things done. So we're really excited and we can't wait for everything to get started up. So it's going to be excellent. How many beds on the respite side? So we can accommodate 17 max. It's a very small facility, just like Nicole and Don were talking about. So we're doing the best to get in as many people as we can, but 17 is what we're permitted for. Okay, I'll keep an eye out for questions, but Diane, if you're here, I think you're here, and if you want to take over, please do.
Hi, this is Diane. I'm the Family Shelter Program Specialist with the Whatcom Homeless Service Center. And yeah, so I'm going to be flying by the seat of my pants because I didn't know I was going to be speaking today. We have currently, we created a new memorandum of agreement for our hotel partners this year. And so far we have actually 4 motel and hotels that have signed up to be partners for us during this winter season. However, one of the hotels is undergoing renovations for the winter season, so they will be out of service for us. So that will leave us with 3 hotel motels that are available for our clients at Opportunity Council so far. And I believe that that's all that I can share with you right now. If anybody has any questions, I can try to answer those.
Yeah, it looks like Danielle has a question. Go ahead, Danielle.
Oh, I just wanted to throw in a bit more about the family emergency shelter for winter months. We do anticipate that it will be starting in about 3 to 4 weeks. And this will be for families with unsheltered children. And it will run from end of October till March. Our capacity will be 40 families at a time. And for families to be able to access screenings, they would contact the Community Resource Center. And I think there's one other thing I wanted to mention. At this time, we don't know if we will be offering additional supports after March. Extreme heat, smoke conditions, things like that. I'm not sure if we'll be able to support families, but this will be for the winter months. We can offer shelter options for families with pets as well, but we do try to limit that amount and really work with these motels and hotels to try to accommodate the families. Families will be getting case management. They will work with a case manager from the moment of their screening, intake appointment. They will be receiving weekly case management meetings in person. Let's see. How do folks get connected? They can contact the Community Resource Center here at Opportunity Council at 1111 Cornwall, or they can call the main line. It will be, I still haven't gotten all the details if we're going to be doing appointments based or first come, first serve. It's probably, we won't know that until the next week or so. For folks connecting, do they need to have a housing intake or have been unsheltered the night before? If they have not done an intake yet, they will with the case manager after the screening, or the CRC will complete a screening with them at that time. This will be for families with children where the children have no other housing options, and they will be asked where they stayed the night before. So we are targeting, at this time, we are targeting unsheltered families, more specifically unsheltered children. Yeah, if y'all have any other questions, feel free to reach out in the chat.
All right. Thank you, Danielle and Diane as well. Appreciate all that work that goes on in the background. And yeah, I recognize that this is a daunting task to manage. So I appreciate your work on that. I think that moves us on to the county severe weather shelter. I'll give some quick updates on that. So this will be the second year that Whatcom County Health and Community Services is looking to operate a severe weather shelter. We've got some criteria using, again, what I referenced earlier, that 32-degree low overnight for 4 or more hours. It's a little bit nuanced, and there may be a little bit of adjustments there as the season goes on and we see how that looks. It's challenging, I can tell you, to operate on a weather dependent basis because there's so many variables there. But we are in the process of securing a site. Unfortunately, we don't yet have a place set in stone where we are going to operate. There are a couple that we're looking at. We've got our preferred one and we've got a backup plan. And then we've even got a backup plan that's less preferred. But we'll make it happen one way or another. We know this is a really important need for the community, and we're prepared to do that. So we've budgeted funds for it. We've got about $450,000 committed through the Consolidated Homeless Grant, which is a biannual grant we get from the Department of Commerce, mostly assuming that our cost will be staff, but also some supplies and perhaps a lease will be a piece of that as well. Last year, we operated for 20 nights and a handful of days during that real extreme cold snap in January. So we're shooting for something in that range. Although, as I said earlier, having a weather-dependent model makes that difficult. There was some work done with a subcommittee of one of our public housing advisory committees to kind of dial in some of the parameters. And this is kind of the compromise we came to. So we have a website, whatcomcounty.us. There's a way to navigate there to the severe weather shelter information. We'll get that up on the RIC, so folks have a more convenient way to do it. Thank you, Jane, for adding to the chat there. We are in the process of hiring a slew of temporary on-call shelter assistants. Those interviews are started already, but we are looking to bring on some more folks, and we'll be doing some rolling hirings throughout the month of October. So if you or someone you know is looking for a way to get a little more involved with community services, maybe just pick up a little extra pocket change, or you never know what to do with yourself in the middle of the night when it's snowing, this is a great opportunity for you. So go ahead and take a look at that or share it with your friends. Michaela, I'm wondering if you might have anything you want to add to that. Janie, thanks for the hit on the chat there. If you have anything else you want to add, there's a lot of details that I'm probably not hitting all of them. But that is the rough plan.
Yeah, I would just say from working at the severe weather shelter last year, I think a lot of folks found it to be a really positive experience. It's cool to also just, if depending on what work you do, to see that function of sheltering services. And yeah, it's an on-call position, so we look for people to fill the shifts. So there's some flexibility there. To be honest, it often, the cold nights, it can be hard to find people. So someone who's committed to showing up and supporting others during challenging weather is always great. So that's probably all I have to add. Thanks, Chris.
Great. Thank you, Michaela. Any questions there? And there was a question that slipped into the chat there around hotels. Vaughn's interested in hearing about what kind of going rates we're seeing at motels these days.
It varies from motel to motel. We have some partners that are charging $89 a night, and then others that are charging $129 a night. So it depends on the amenities, and it depends on the hotel.
Thank you, Diane. So this takes us into the next part of the agenda, which is the Q&A for shelter operators, which I feel like got mixed in pretty well. But if you've had time to think about it and questions have come up, it's not too late. So how many beds is a severe weather shelter? Thank you. That is a great question. So we will be a little bit, we'll know once we get the site figured out. We're hoping that 50 is kind of the minimum. Ideally, we'd have closer to 75 or maybe even 100. We'd love to have 2 sites. There's a lot of ideals that we're probably not going to be able to hit. But we do feel like 50 is a minimum. 75 is what I'm hoping we'll be able to do. Some of this is going to depend on funding. If we can find some additional funding or we get a great deal on the lease, we'll be able to have a bigger staff. We don't want to have an improper staff to guest ratio. So we'll be a little bit limited by that. But I think the 50 to 75 range is probably a good estimate, given that we don't yet know some of those details, and it's possible that it'll be a few more, a few less. Thanks for the question. Are there any others? Oh, and the timing, we're hoping to have that ready in case there's an early storm at the beginning of November. We probably won't have our whole staff up and trained for a couple weeks later. But last year we used a good deal of health and community services staff to augment the folks that we hired. So I think we'll be ready to go early November, and we will plan to go until probably sometime in early March. But that might depend on how many days we end up operating through the winter. We're not set at 20 days. That was just how many we ended up doing last year. So I could see us doing a few more or a few less, just kind of depending on how it goes. Obviously, we want to be open as much as we can. We'd love to open with the weather not quite as bitingly cold. We'd love to have more beds, but we have some trade-offs that we have to consider in light of all the other programs that we're trying to fund and manage. Okay, well, I think we'll move on to the City of Bellingham update. I don't know who, if anyone from the city is here today. Is there anyone from the city to provide an update? The usual folks who attend, I don't see in the participant list, but I could be missing something. Okay, I guess not. Well, then we'll move on to the county update, which is a standing agenda item. The big news is around the shelter, which I already shared. We are also working on our 2025 budget and contracts. I guess the budget's pretty much done. It's just the contracting work that's getting finished up now. Not a ton of changes from the housing program here. We're expanding a little bit north with Ferndale Community Services. We have a stronger partnership there than we have in the past. So we're excited to see more of our services get out into more of that rural part of North and Northwest Whatcom County. We know that there's a lot of homelessness in Bellingham, but we know there's a lot of it outside of Bellingham. So we're trying to see some of those services get out there a little bit more too. We're also continuing with our bread and butter programs, rapid rehousing projects, permanent supportive housing, specialty emergency shelters to serve populations that aren't well served in larger congregate settings. I was hoping I could do a little bit more thinking on this while the city was doing their update. So I apologize for not being better prepared. It's been a busy week here. But if there are questions for me about what's going on at the county, I'm happy to take those. Otherwise, I think we can move on to the other updates. There are 43 folks on the call. So I guess I'd invite folks to share anything that's changing with their agencies, with their work, things they want people to be aware of, or just kind of things that they wish people would think about and talk about more as it relates to housing and homelessness and housing stability. So with that, I'll click mute. Looks like Jim's got an idea to share. So yeah, go ahead, Jim.
Yeah, I very, very impressed with some of the new exciting things that are going on, especially with the collaboration, both in terms of the public sector, state government, local government, as well as our nonprofits. But I'm also impressed with especially the faith communities that have stepped forward. What she talked about in terms of the YWCA, Young Women's Christian Association, that has expanded their housing for women and children and looks to be state of the art to me in terms of the way they're handling it. And the Lighthouse Mission, that facility is probably one of the most up-to-date in the nation. So there's been a lot of collaboration, and the faith community has played a huge role, not only in supporting our nonprofits, but also in kind of leading the way. The Interfaith Coalition is always looking for ways to help our neighbors in need. So a lot of great things happening in Whatcom County. That's all I have to say.
Yeah, thanks, Jim. And that's kind of the point of this coalition, I think, is to bring together all those different folks. Homelessness it's a huge problem. It's a diverse problem. It requires a lot of different types of solutions. So many hands make for lighter work. And I know I'm really grateful for folks like Unity Care, for the YWCA, for everyone who's expanding and doing more to help be part of that solution. I don't think any of us can do it alone, but by working together, we can take chunks out of the problem and make things a lot better for the people that we serve. So yeah, thanks, Jim. Other thoughts? All right, well, I think if we're done, we're done. Info on warming stations. Thank you, Eve. I don't have anything real informed to say to that. I know the library has been a place that's kind of informal in the past during the day. I'm not aware of any changes to their policies or any other new facilities. Places like Recovery Cafe offer that opportunity in sort of limited ways. But I don't have anything really else to say about warming stations. Are there folks on the call that do you know anything about places for people to stay warm during the day? That is worth, I think, emphasizing on the severe weather shelter I was talking about that the county will operate. That's going to be an overnight shelter. So we will ask people to leave in the mornings and come back in the evenings. It warms up a little bit during the day, most days, but that does leave an important gap there. And Eve, I appreciate you bringing that up. So if folks have any information about that, it'd be great to hear it. And maybe while people are thinking or typing on that, I'm going to go to this comment from Ray here. It says, first time work for a new nonprofit based in Seattle, but I'm doing work in Whatcom County, based in Bellingham, primarily serve clients through GOSH. But as we get more funding, we will be able to support more non-GOSH clients. You can find us at cornerstoneyouthcollective.org. Thank you, Ray, for sharing that information. I don't know that everyone knows what GOSH is, and I'll be honest, and I've heard that term a few times, and I think the S and the H are supportive housing. But if anyone wants to enlighten me or the rest of the, well, other people probably know more than I do. But yeah, Ray, do you want to talk about that a little bit? I'd invite you to share.
Yeah, I think it stands for Governor's Opportunity for Supportive Housing. Basically, people are discharged from Eastern State Hospital or Western State Hospital, and that makes them eligible for GOSH, which sets them up with an apartment. They pay 30% of the rent, but even if their income is zero, then that just means 30% of zero is zero. GOSH also like has a budget to pay for like a minimal amount of like furnishings. And then through Cornerstone Youth Collective, we just we're new, but when we take on clients, we stay with them like throughout their time through GOSH. So which can be renewed. So we're looking at building up all our other programs that are listed on the website, but primarily we're doing housing and doing things like helping people get forms of ID, sign up for health insurance, things like that.
Yeah, that sounds great. Yeah, I'd love to talk more. If you wouldn't mind shooting me an email or making sure you're on this list. Yeah, sounds like a wonderful thing to bring up here.
I was wondering about the saw that John Ryber he wrote a in his intro he wrote that he's developing a media project addressing homelessness, and I was wondering if John could speak a little bit more about that.
John, we're seeing you, but you're on mute still.
Now you hear me? Why is everyone else on mute? Okay. Yeah, I'm working with the ACH, North Sound Accountable Communities for Health, and I'm a filmmaker. Most of my experience has been abroad. I worked in Africa for many years, and our approach is basically using narrative, entertainment, what we call social impact entertainment approaches, radio serial dramas, television programs, feature films, that kind of thing. And we're now trying to maybe apply what we've learned from working abroad here in our community. I've been here living in Bellingham now for 5 years. I'm sort of semi-retired, but my son works very closely with the Children of the Setting Sun productions. You might have heard of some of the films being made there. And we're just at the very formative stages of this project where we're trying to get a sense of, how to approach this very complex, very emotional, topic that I think influences all of us. We think it's a interesting subject to address in the way that we have been making films and television programs. The company that we have a nonprofit called Media for Development International, which is established in 1989, and so it's quite old now. And I do have a website. I can, it's not much on it, but you can see some samples of our work and stuff. Maybe I'll put that on the chat. I'm also really not very familiar with these technologies, Zoom and that kind of thing. I arrived, just got back during the pandemic. So anyway, yeah, so that's what we're doing now. And yeah, I'm just trying to get a handle on all the approaches that are being used, the complexity of this issue, and eventually you'll be hearing more about us. And we're reaching out to many of your organizations, I'm recognizing now, because we're at formative stages and we need to learn about the subject.
That sounds really exciting. What a topic to tackle. Very complex, very interesting. Yeah, thanks. We're glad to hear you're working on this, John. I know Vaughn's gonna be really excited too. He's very interested in infotainment, and when you started talking, I was like, oh yeah, oh yeah.
It's true.
And good catch. Thanks for noting that in the chat there, Vaughn, and bring that up. Other thoughts, ideas, or questions? There's a lot of really connected and intelligent people on this call right now, so this is a great place to ask questions. And I promise I'll let other people answer them. All right. Well, oh, there it is. I was like, I bet someone's typing something. Yeah, thank you, John. So he's got the website there, mfdi.org. Cool. I will definitely check that out. Well, thank you everyone for joining today. It seems like we're maybe at a natural point with the questions concluding. Get on that email list if you're not on it. If you have a question for the group, yeah, send that out to the list and they'll get it out to where it needs to go. But thank you everyone so much for guest presenting today. Spending your last hour and a half of the day perhaps with us. It's great to be working through these things. It's great to celebrate the work that's being done. I know so often we see the folks that aren't getting served, and it hurts to see that persist. But each of us putting our hands together and lifting up the folks that we can does make a difference. So I applaud you for your work. Thank you all for your contributions, and we'll see you in December. I think the next meeting is going to be on December 5th. So some of you I'll probably see before then. Otherwise, I'll see you back in December. I hope you have a great fall. And thanks again for the work you do. All right. Take care.